What's up, guys? My name is Mike Tatarowitz, and today I'm going to talk about amyotrophic lateral sclerosis. What is ALS? ALS is also known as Lou Gehrig's disease, more commonly. It's a progressive degeneration of the motor neurons. It's where the motor neurons are no longer plugged into the spinal cord anymore, so the voluntary muscle movements cannot be followed through. You can't control them, and over time they'll die because they're getting no attention, and you need to use your muscles to keep them. Amyotrophic, it stands for no muscle nourishment. And that's what happens when you have ALS. You can't control your muscles, they get no nourishment, and soon after they will die. And it's a progressive disease. There's been no cure or way to reverse it. So it's hard to deal with, and first you'll lose your motor skills, the fine motor skills like picking up objects, grasping them, and then it'll move on to more serious things like walking. Off to the right here, there's a little picture with a diagram. The picture on the top, it's a picture of a healthy motor neuron where the central nervous system can send impulses to the muscles and you can healthily control them and stimulate them. The picture below with the gray motor neuron, that's a dead motor neuron, and that's what happens when you have ALS. It causes your muscles to weaken because they're no longer firing, you can't use them, and over time you'll lose them because of this. Signs and symptoms. Early signs include trouble grasping objects, change in your voice pitch, muscle spasms or abnormalities, progressive muscle weakness, abnormal fatigue, slurred speech, or difficulty breathing. As you can see, most of these signs and symptoms are pretty general and apply to a lot of other diseases that are around in the world. So that brings me to the diagnosis and why it's so difficult to figure out if somebody has ALS, or it takes a long time to diagnose. So for diagnosis, there's no one test. It's more of like a process of elimination. You have to do a bunch of common tests. Some of them include a nerve conduction velocity test, a EMG, blood and urine test for blood protein, spinal taps, x-rays, MRI, myelogram of the cervical spine, and muscle biopsy. This is kind of what makes it so hard to diagnose somebody with ALS, because there's just no one test that rules everything else out. You have to take into account a bunch of different tests and from past tests and compare them, and that's what's so difficult, and there hasn't really been many answers when looking into ALS and trying to find a cure or practices that help it that much. So it brings me to that most people that have been diagnosed with ALS don't live longer than 3 to 5 years. There's outliers that have lived longer, like Stephen Hawking, who survived it for over 40 years. But in most cases, you'll have 3 to 5 years after a diagnosis. For the risk factors, there's no conclusive evidence of an environmental risk factor, and there needs to be a lot more research and studies to have an accurate idea of what's causing ALS, because as of right now, there's not much concluding evidence of why it affects certain people. But what we do know right now is that most diagnoses happen between the ages of 40 to 70, 20% more common in males, and 93% of the cases are Caucasian, which is huge, but still no reason why it's just mostly affecting Caucasians. And also there is a link to military veterans. They're approximately twice as likely to be diagnosed. But once again, there's been no link to why or any interventions to help lower the amount of cases. So fundraising for ALS. I'm sure all of you guys, or most of you, have heard of the ALS Ice Bucket Challenge that was in 2015. Which raised over $115 million within a 6-week span, which was huge, because before that, and also after that, there had never been that much money being flowed into the ALS organization. So this was extremely helpful for an increase in the research provided, and hopefully pioneering the way for a cure to the disease. So this graph here below, it kind of just shows that from 2000 to 2016, there's been an increase in fundraising for ALS, which is good. There's been a little more awareness, and since the ALS Ice Bucket Challenge happened, there's been a lot more fundraising, just because a lot more people know about the disease now, and before and prior to that, there hasn't been many things letting people see and putting it into the eye of the public. So that was a great event, and hopefully it'll keep on helping fundraising happen. Funding for ALS. The ALS Association reported that they used about $35 million in total expenses for 2017, which is compared to about 26 million in 2014. So they're getting more money and being able to use that in different ways, which is good. They have about 10 million more since 2014, which is great. The diagram down here shows that what the money was allocated for. So about half of it was for research, 22% was for patient and community services, 10% for public and professional education, and 13% for fundraising, and about 5% for administration. Here's a little chart of the ALS death rate. It's a little dated, but from 1952 to 2000, you can just see how there's been ongoing more cases happening in the U.S. Still no reason why that there is more cases happening, but leading to more deaths. And if this chart went on to 2018, you'd see even greater increase of death rates and cases. So the management and treatment. Right now, there is no treatment that can reverse the degeneration of the motor neurons. There has been some therapies and medications that help with delaying the onset and helping people live a normal life for a little bit longer. Something along those lines is a stem cell therapy, which has been shown to be neuroprotective and has delayed a disease onset. Another medication called Rizol has been successful for medicating ALS patients. It prolonged the survival time. But as of right now, exercise has been the best intervention for ALS. It has shown to keep motor neurons plugged in for a longer time, keeping the central nervous system communicating with the peripheral nervous system. And also, exercise has always been there for helping with stress, anxiety, depression, which comes along with this chronic illness because right now there isn't much hope with ALS, so it's a tough disease to deal with mentally. A lot of people get depressed after being diagnosed knowing that they only have a few years left at best in most cases. So it's hard to be hopeful, and so exercise helps them physically and also mentally. So it's the best thing you can do for right now. So for my case study, I have a male who's age 54. He was diagnosed with ALS 3 months ago. A blood pressure of 126/82, BMI of 26, a total cholesterol of 192 milligrams. He was not active, but interested in activity now that he was diagnosed with ALS because he hears all these benefits about how it can help him live a little bit longer and stay in tune with his body. And he just started on medication of Rizol. So for this case study, I would prescribe 3 times a week 40 to 60 minutes on an outdoor walk to help clear his head and give him some aerobic exercise, keep his legs working. And next, I would have 2 to 3 times on a stationary bike or an elliptical, something that doesn't use much fine motor skills. It just grows, and you don't have to worry about the balance that he has or him losing balance, because that's also a danger with ALS. You're going to lose your balance because you don't have all your muscles working anymore, so you're not used to that. It's going to throw you off a little bit. So the exercises I chose were pretty safe ones, nothing that is going to push his limits on what's safe for him. So I did stationary bike, an outdoor walk, and then lastly 1 to 2 times a week on a row machine just to help with the upper body because the other two aren't focused on the upper body. So 1 to 2 times a week on a row machine for 15-20 minutes. And the exercise plan is focused on keeping him safe while also getting aerobic exercise in, because I also read a study that aerobic exercise is best for keeping your muscles in tune with your central nervous system. So resistance training would also help, but in this case it's just better to stay with aerobic, and that's what helps him the most is what's going to keep him active, and also all of them should help him stay low on his stress and anxiety and hopefully keep him away from a depressive state. Okay, if you want to learn more about ALS, you can find great information at the ALS Association website, and any more questions you have should be found here, and you can click the link below. And also, any donations are greatly appreciated, and this link below will help you donate if you have an interest for that, which all donations will be greatly appreciated, used for research, and hopefully for a cure in the years coming up. And I just want to thank you for listening to me talk about ALS, and I hope you guys learn some good information about it and take away some of this, and I guess have a little bit of sympathy for people with ALS, because it's just such a difficult disease to deal with, and it's one of the worst ones out there. And here's some of the peer-reviewed references I used for making this production, and just want to thank you again for listening, and have a great day.